From 31 January 2023, the Voluntary Assisted Dying Act will be in place in South Australia. The introduction of safe, accessible and compassionate voluntary assisted dying will give eligible people with a terminal illness choice at the end of life. The Act includes many safeguards to ensure only eligible people access voluntary assisted dying and protects vulnerable people from coercion, abuse and exploitation. A person can only access voluntary assisted dying by being assessed as eligible by 2 registered and trained doctors. To assess voluntary assisted dying, a person must meet all of the following eligibility criteria. They must be an adult, they must be an Australian citizen or permanent resident, they must live in South Australia and at least for 12 months. They must have the capacity to make a decision about voluntary assisted dying. They must be acting freely and without coercion. They must be diagnosed with a disease, illness or medical condition that is incurable, advanced, progressive and will cause death. The disease, illness or medical condition must be expected to cause death within 6 months or 12 months in the case of a neurodegenerative condition. And the disease, illness or medical condition must be causing the person suffering that cannot be relieved in a manner that they consider tolerable. It is important to remember that only the person who is considering voluntary assisted dying can start the conversation with a health practitioner. Under the legislation, health practitioners cannot initiate the discussion. The person accessing voluntary assisted dying will need to make 3 separate requests. The first request should be made to a medical practitioner. If they accept, they become the coordinating medical practitioner. If a medical practitioner chooses not to participate, it's recommended that they advise the patient of where they can get more information or refer them to someone who can help. A consulting doctor will complete a second assessment before a second request can be made. The second request is a written request that is signed by 2 eligible witnesses. The final request will be made to the coordinating medical practitioner. The process can be stopped at any time and services are available to support people navigating the voluntary assisted dying process and their loved ones. If thinking about voluntary assisted dying has raised issues for you, there are supports available. For more information, visit the SA Health website.